Historically, challenges affecting our mental well-being were something people kept quiet about. Seeking care often came with a stigma. But in recent years, the importance of self-care and addressing mental health concerns has emerged with a new acceptance. More people are open to therapy and discussing mental health with family and friends. There's also a greater focus on the mental well-being of children. The U.S. Surgeon General referred to the challenges young people face as uniquely hard to navigate. Many families are exploring experiential therapies, an approach that includes activities such as role-playing, art, music,
Hey, hello, it's time for some music.
and the use of horses to improve a child's overall well-being. Horses, they're highly intelligent, empathetic, and social animals. They communicate their needs and emotions through vocalization. But they're also two-way communicators. They can read humans through our postures, physical movements, and facial expressions, making them an excellent support for our mental well-being.
Oh, he's so cute.
Mental health is an important part of a child's overall health, affecting how they think, feel, and act. And horses, with their empathetic traits, are being put to work alongside mental health professionals to support the emotional needs of children.
Spending time with a horse like Yoshi here through equine therapy can benefit those who struggle with emotional regulation and impulse control.
Nice problem solving.
When you walk into an arena with a horse, you're not sitting in a chair staring at the therapist in a room. We kind of stand back, and those horses, they show up for people in ways that I've never seen. You're just asking her to move out and to move around.
Renee Affolder is an equine specialist at Arise Equine Therapy in Forestdale, Missouri. Equine therapy requires 3 experts to facilitate a therapy session: the equine specialist, a mental health professional, and of course, a horse.
Horses, they're prey animals. Their herd is really important to them, and their biggest concern is safety. And there's a lot of science behind this, but we work a lot with kids, so we'll say, horses tend to stay in that lower region of their brain, in that fight or flight, because that's what's kept them alive for all these years. When someone's gone through trauma, any type of trauma, that can happen to them as well. As a person, you can get stuck in that lower part of your brain. So a horse relates to us really well, and they start working with that person, and they start developing a connection with that person, which turns into a relationship. And we focus on healthy relationships. Same principles that we would use to build a healthy relationship with a person are the same principles we're going to use with that horse.
Who is this right here?
This is Candy.
Abby is 11 years old. She's more than happy to get up early on a Saturday to spend time with Candy, and she's not afraid to talk about why.
We usually have a connection when we usually come out.
What is so great about horses?
They know how you feel, and they know how to make the person feel better.
Talking about our feelings, emotions, trauma is easy for some and very difficult for others. Often experiential therapies like working with horses can allow young people to share their thoughts in more comfortable ways.
So as long as we keep that conversation about the horses, it's amazing what can come out during a session when in return they're really talking about themselves. Look at this. What do you think that is?
A bite mark?
Bite mark, yeah. I wonder what happened.
Remember when he was near the horses were picking on him?
I do.
So it's probably still there.
You think so?
Yeah.
Is that kind of like when you went to a new school and you were having some trouble with friends? Yeah.
Tia Kramer is a therapist at Arise. She says for some, the isolation of COVID exacerbated underlying anxieties.
I've seen an increase with kids just because they were isolated during COVID, and building that relationship with the horse and feeling that connection and it being a comfortable feeling. So our hope is that they build those connections and relationships and they look forward to coming back and seeing their horse or the horse that they've connected with, and that those feelings maybe carry on throughout their week with other relationships.
What do you think he's telling you?
Willow, I think I'm getting a bit hungry.
I think you're right, Willa. I think you're really in tune to his feelings.
Often parents don't know when therapy might be needed for their child. Identifying what's a phase versus injury and pain that is unseen and growing may not be obvious.
Remember, you're his leader.
Kramer advises that if normal behavior for your child has changed and basic needs aren't being met, get it checked out.
I look at mental health like any other. If they had a toothache, how bad is this? Are you able to eat? Are you able to do things that you should do during your day? Do we need to go to the dentist? And coming to therapy shouldn't be any different than that.
For Living St. Louis, I'm Anne Marie Berger.